back to Patients Relating Doctors because they forgot to include this lesson in the patient school. Oh, you didn't have patient school? That's okay. We'll give you a little bit of background. So the background is that patients don't always know how to relate to doctors. Doctors learn about it in their school, but patients somehow in their school don't learn about that. So today I'm helping you, telling you about how urgency is thought of differently between doctors and patients. And the idea that patients and doctors think of things differently is quite obvious, I would say. Just for my example, so I work as a traveling doctor, shall we say, and so it was very easy for me to move around, getting used to a new hospital. No big deal. It takes me, a few weeks at max, maybe a week at some. And so it's not a big deal for me, but for a lot of other people, it's a big deal because they're not constantly moving. For me, packing up, moving every night, that's fine. I've done that before at hotels. That's just my life. For most people, though, that's also a very difficult thing to do. So I think today we're going to talk about urgency and how it's different from the patient side versus the doctor side. Recently, I had a friend who was asking me about some issue, some nervous system issue. And it's funny because I was thinking, this is pretty serious, this is pretty urgent. And he was like, I've had this for a while. I think it could wait a little bit longer. I think that's where the difference comes in, how we view urgency. So first of all, starting from the patient side, something is urgent based on how long they've known about the problem. How long they've had the problem, basically. I've had symptoms already for, a few weeks, a month or so. So yeah, not really getting worse, so I think it's okay. The doctor, urgency, the timer starts when the doctor finds out about the problem. It's not when the problem started for the patient, it's when the doctor finds out the problem. Not necessarily when the patient tells the doctor, but when the doctor realizes there's actually a serious issue here. That's when we got the results of his MRI scan. Then I said, there's an issue, we better act on this quickly. But his point is, I don't feel any different. Why does the MRI scan change everything in the world? And I think that's sort of the thing. Our timer starts differently. Our timer doesn't start when the patient tells us. Our timer starts when we figure out there's something serious going on. And part of that's because of this culture of liability in the US where you're supposed to act on results when you see it. They track us nowadays with the computer. They can tell when you clicked on something. Doctor, so I noticed you saw the result yesterday, but you didn't do anything until today. Can you explain why? It's like, yeah. So as a doctor, you're supposed to act on stuff right away. But I think the other part is a little bit more complicated, and that's what we're going to get into here today. So when we talk about urgency, the classic example is the emergency room. So you go in and you're like, my hand hurts so much, I crushed it, see me right away. And this old man who comes is like, I think I'm a little short of breath, a little bit of chest discomfort, and he gets seen right away. He just showed up. I've been waiting here for 2 hours and you haven't bothered seeing me. And that comes from the medical knowledge of a situation. So yes, doctors could always be wrong, but we have a little bit of medical experience, a lot of knowledge in our textbooks. We read a lot of stuff in medical school. And so we know that some things need to be addressed right away and some things not so much right away. The best example I could give for that is I diagnosed a person with cancer. So obviously that's not a good diagnosis, and they're like, what we're going to do about it right away? And you're like, nothing. So we'll get some tests done, we'll do this, we'll send off a referral, and yeah, we'll have the oncology see you and follow up in clinic sometime. What? They have cancer. They just diagnosed the cancer. But from our perspective, that cancer didn't literally pop up today. Didn't pop up yesterday. It's been there for weeks, if not months. So what is a day or two going to do? What is even a week or two going to do? It's not really going to make a difference. They've already had it for a long time. And then there's a confusion. Like my friend who says, why are you so worried? Why is this so urgent? I've had this for a month already. And the reason is, when you have neurologic injury, when you have nervous system injury, like they talk to you about strokes, there's all these advertising campaigns out telling you that if you got a stroke, seek attention right away. Time is brain. Say that same for heart attacks. And the idea is that the body may be able to recover, but if it's damaged for too long, it may not be able to recover anymore. And that's why it's urgent to do these things. And that's why I feel I'm pushing him to do stuff quicker, even though he doesn't feel worse. Because the idea is that we know logically that there's a certain amount of damage a nerve could take before it can't not recover. I don't know at what point it'll be irrecoverable, but I don't want it to get to that point. So I'm doing whatever possible to prevent it from getting to that point. And I guess from his perspective, he's like, well, I don't feel any different. And that's true. He doesn't feel any different. He's felt the same as he's felt for weeks, literally. But the thing is, for us, it's the idea of preventing damage. So I think when your hand is crushed, it's crushed. Yeah, we'll fix it, but the damage has already been done, and there's not much we could do. We can't heal your bone magically. Healing process takes weeks, literally 6 weeks to fix a fracture. Your bone's gonna heal by itself. So it doesn't really make a difference if we see you right now. But that guy who's having a heart attack, yeah, if we could get in right away and rescue that blood vessel, we could save his heart. That's something worthwhile doing. I think that's where we have a difference in thinking about urgency. I just hope this little talk will help you understand where the doctor's coming from, why we may have a different idea of urgency. I think we come from different cultures, we don't understand each other, sometimes literally that we don't even understand the words we're saying to each other, right? We use big words like, oh yeah, I think he has some takasubos. I think we probably should do a catheter to make clear those coronaries are clean, but otherwise I think it's just basically conservative management for now. You're like, I think you're speaking English, but I have no idea what you just said. And I think in those situations where you're not clear why something's urgent, when the doctor is really persistent that it's urgent, maybe just ask a little bit. The doctor's busy with something urgent, and then you're sitting there, you're not urgent, as in explaining to you actually is not urgent, like I talked about before. But yeah, I think you should be in the loop. You're the patient, you want to know what's going on. I completely agree. I think doctors will generally agree as well. I think just saying, I think we may have a little bit different idea. Do you mind explaining to me why it's so urgent when I've had this for so long? I don't think they'd mind taking a minute to explain. I think it's just helpful to understand that we're coming from different perspectives. To have a little bit more understanding for each other will go a very long way to making the patient relationship with the doctor much better.